Hello, my name is Dr. Lance Carroll. I am the clinic director at Quad Cities Regenerative Medicine located in Moline, Illinois. I want to congratulate you for taking time out of your day to seek information about our regenerative medicine program. And what I'm going to do today is I'm going to go over our program with you, tell you what we do and why we do it. So let's get going. What we'll cover today is what is regenerative medicine, what are stem cells, how do they work, what do they help, and are they safe? So I mentioned I am the clinic director. This guy in the picture on the right, his name is Dr. Jeremy Carrier, MD. He is our medical director. And in the picture below him is our nurse practitioner, Amanda Alonji, who does our injections for us. And a little background about me, I am a chiropractor, graduated from Palmer College of Chiropractic in Davenport, Iowa, back in 2001 as a valedictorian of my class. Have been in private practice ever since. And basically, why would a chiropractor be involved with regenerative medicine? Chiropractic is really looking at trying to get our bodies to heal themselves. And it's the same thing with regenerative medicine, just putting something into the body that is going to help that process. Now, we've got patients that come to our office not only from throughout Illinois and Iowa, but also other surrounding states to find a solution to what troubles them. We've had plenty of patients who have told us, you know, you're the best office we've ever been to, things like that. And not only because of the results that we get for people, but just because of how much we care about them. And, you know, I'm an authority on regenerative medicine, probably one of the lead authorities in the Quad City area, if not the lead authority, because of the amount of study that I put into it and the number of patients that we've treated. So if you or a loved one have been diagnosed with a bone, joint, ligament, tendon, muscle, or nerve problem, today's information could change your life. It's a new paradigm. It's a non-operative treatment that can actually repair damaged tissue. It's low risk, it's outpatient, and it's effective. And isn't that what medicine has been looking for? We're tired of these complicated treatment systems that you can't go back to work for months and you have all kinds of side effects. Regenerative medicine is an approach to healing that focuses on getting the body to heal itself, just like I already kind of stated. It deals with the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. So, you know, some of you might have heard of lizards that when they lose part of their tail, the tail grows back. Well, that's what we mean by regeneration. How much research is out there? There are over 4,000 studies on stem cell research. Umbilical cord stem cells have been collected for decades. And the websites clinicaltrials.gov and PubMed.com have many of these studies out there. In addition to that, regenerative medicine methods are now being studied at most major universities, a few of them listed here: Stanford, Harvard, Cambridge, and the Mayo Clinic Center for Regenerative Medicine. We've also got on our website at www.qc-rm.com, we have several different studies that are listed there talking about the benefits to stem cells and umbilical cord tissue. If you're looking for some more information out there, there's this good book, Stem Cell Therapy, A Rising Tide, written by Dr. Neil Reardon. He is one of the early pioneers in stem cell research and has had a clinic down in Panama for a number of decades. Let's look at knee pain. Traditional treatment options, all were designed for relief, but were not a fix. We've got non-steroidal anti-inflammatory drugs, or NSAIDs, also pain medications, and bracing or using cane. We got cortisone injections, as well as hyaluronic acid injections, a lot of different names for that, Synvisc or rooster comb or chicken fat, whatever. Also, clearly, knee replacement is an option. And you know, if you live long enough with knee replacement, you're going to need another one because it will wear out over time. About 35% of people that have a knee replacement are feeling great at 5 years, and it's a good thing because they're getting ready to have another one in another 5 years or so. So what about painkillers? We're talking about opioids here. There are no healing properties, as well as with the NSAIDs, there are no healing properties, and they have a lot of dangerous side effects involved with them. With opioids, there's seizures, constipation, fatigue, decreased sex drive, and we know that they're habit forming. And there is a big rise in opioid overdose deaths. Over the last couple of years, there's been an average of more than 1,000 people who died per week in the US from these opioids. And then there's cortisone injections. They're powerful anti-inflammatory, but at what cost? Once again, some big side effects. They cause cataracts. They suppress the immune system. They weaken tendons and ligaments, which can lead to rupture or tearing of those. Osteoporosis and osteonecrosis, so bone density loss or bone death. Up to 8% loss of bone in 4 months' time, studies have shown. So if you're having 3 of those in a year, that's quite a bit of bone loss. And so that's probably why they say only 3 injections per year. As a matter of fact, the authorities recommend only having 3 injections in any one joint in your lifetime, because more than that can cause some pretty significant damage. And we've seen that on x-rays and patients that have come into our office. We can see that bone loss from multiple cortisone injections. And when drugs fail, the only alternative up until now has been surgery, but all surgeries can have complications. So according to the National Inpatient Medicare Database, almost 5,000 deaths were due to knee replacement surgeries just in 1 year's time. And that doesn't include another 10,000 people who died from complications such as blood clots to the lungs, heart attacks, or pneumonia related to the surgery. And then it doesn't include another 17,500 people who got infections but were lucky enough to survive. And knee replacement surgery can cost an average of $57,000 and is followed by 3 to 6 months of rehabilitation and healing. We did have somebody come to a seminar last month who had told me she had had a knee replacement surgery in 2018, and it cost about $45,000. And she had her other knee replaced in 2019, and it was already what we're quoting here is this average. It had jumped up that much in just 1 year's time. So even with good insurance, the deductible and copay could cost nearly $15,000 to $20,000 for many people. So let's look at the scope of osteoarthritis. Arthritis is the #1 cause of disability. More than 1 million people in the US suffer with osteoarthritis. About 10% of men and 13% of women over 60 years old demonstrate symptomatic knee osteoarthritis. And there have been more than 1 million knee replacements that are being performed in the US each year. And they estimate that by 2030, knee replacements are projected to grow to about 3.5 million procedures per year. So let's look at the evolution of science here. There has been a gap that has always existed between conservative treatment and surgery, but regenerative medicine does now offer that important treatment option to close that gap and potentially help you and many others avoid surgery. This has been around for decades, and there have been certain categories of our US population who have been taking advantage of this for a number of decades. Some of those being professional athletes and others being celebrities. They might have had to go to other countries to get it done back then, and it was quite expensive, and that's why it was kind of limited to who could afford to do this. But now we are Glad to say that we have brought this to the Quad Cities area and making it affordable and doable for people here in the Quad Cities. Now, our success rate is about 90% or higher. So that's 90% that don't have to have a joint replacement surgery. Who do you think is going to get upset about that? You know, regenerative medicine having such high success rates, that's right, it's going to be the hospitals and the doctors doing those joint replacements. And that's why you might hear some of them say that stuff doesn't work or don't do it because they would be losing out on a lot of income. So today we're going to provide you a solution to degenerative pain related problems that is safe, effective, and affordable. Who is a candidate? We see many types of patients for a variety of conditions. However, most are frustrated with long-term use of NSAIDs and or pain pills without improvement, cortisone injections or similar injections without lasting results, home remedies or homeopathic therapies that do not provide relief, inability to perform the activities they used to be able to perform easily, and then constant pain that just won't go away. The power that made the body heals the body. Healing is natural and automatic. So if you break a bone, it heals. If you get a cut or if you have a wound, it heals. We are always regenerating tissue. There is in the human body a 7-year cellular cycle where all the cells in our bodies are replaced. Some tissues have different times that they are replaced compared to others. So for example, in the digestive tract, the cells are replaced every 6 to 8 weeks, with skin every 8 to 12 months. So let's look at stem cells. There's different ways of getting stem cells. Autologous means that we get these stem cells from ourselves. The problem is with that is if we're getting it from somebody as old as you are, those cells are going to be that old too. So they're older and closer to death. There's different ways of getting autologous stem cells, bone marrow aspirate or adipose tissue, which are fat tissue. The other option is to get it from somebody else, and the way that we get ours is from umbilical cord tissue, specifically what's called Wharton's jelly portion of the umbilical cord. And it contains not only stem cells, but other tissues that are really important in healing, have a high healing capability, high concentration of cytokines, growth factors, hyaluronic acid, and what's called mesenchymal stem cells. But when a woman has a C-section delivery, she can volunteer to donate the umbilical cord, placenta, and amniotic fluids. The donated tissue are carefully screened for any form of disease and become available to be transplanted into another person. So why the umbilical cord? Like I've already said, it has these cells and tissues in it that are just have such a high healing capability. As you can see on the screen here, the Wharton's jelly is that protective cushioning layer that surrounds those blood vessels that run from the mom to the baby. So it's got all those types of tissues that I've already talked about, and there's very high concentration of mesenchymal stem cells. For regeneration to occur, the body needs cells that have the ability to rebuild the injured area. But as we age, the stem cells become dormant or non-functional. After we have reached full bone growth, which is in our late teens or early 20s, we only have about 10% active to help us heal. This graph here shows us that adult stem cells are older and they're weaker, and that's why healing slows with aging. I don't know if you've noticed that, but I've certainly noticed that as I get older, I heal slower. So when we're newborn here, we can see that bar on the far left, 1 in every 10,000 cells in bone marrow are mesenchymal stem cells. But as we age, that number drops off significantly down to where we've only got about 10% of what we had when you're newborn. When we get to be my age, age 50, down to only 1/40th of the amount, and it gets lower and lower beyond there. So number one, we've got fewer stem cells. Number two, we've got older stem cells that are weaker. They're going to have less growth factor in them. And growth factor is really important in getting this healing process going. And then number 3, there's decreased oxygen, so the stem cells can't release those growth factors. All right, so let's look more in depth. What is a stem cell? What does it do? A mesenchymal stem cell. A mesenchyme just means tissue, so it's going to be the type that is going to be better suited for regenerating tissues. As we can see on the bottom, it differentiates into multiple tissues: muscle, bone, fat, cartilage, tendon, ligament, nerves, all those things. In addition to that, they do reduce inflammation, and when you reduce inflammation, that generally will also reduce pain. Another thing that they do is they fight what's called apoptosis, which is cell death. So like I said, our bodies are continually cells dying and being replaced. Well, stem cells will decrease that rate of cell death, so they stop or slow down the degenerative process in addition to regenerating tissue. And these stem cells do self-replicate, so they will divide. One cell will become 2, those 2 then divide and become 4 and 8, 16, 32, and so on and so on. So how we heal? Inflammation from your damaged cells creates a signal. It's called the paracrine signal. It signals stem cells for help. So the stem cells then find those damaged cells and attach to the local blood vessels. And then as long as oxygen is available, stem cells transfer the growth factors into the damaged cell. And the growth factors rejuvenate the damaged and dying cell, and tissue regrows and heals. So stem cells go where your body needs them to go and become what your body needs them to become. With the regenerative medicine procedures, not only can you eliminate your pain, but repair, rebuild, and heal the problem area. In our practice, we use regenerative medicine products and protocols designed to restore your injured and painful area to as close to normal as possible. Some people, realistically, their joints might be so degenerated or worn down that we can't ever expect to get it back to normal. So the goal then is to get relief of pain and to get the joint to as close to normal as possible. Are the treatments FDA approved? They cannot be FDA approved or denied because the FDA does not consider them to be a drug. So you just don't fall under that category that they approve or not approve of things. However, the FDA has given specific guidelines that must be followed in order to be in compliance with the FDA. So we have to follow those guidelines. The tissue banks where we get our tissues from, they have to follow the FDA's guidelines, and if they don't, then they will be put out of business. If we don't, we will get in trouble and be put out of business. So the FDA is definitely regulating what we do. Regenerative cellular therapy is safe, it's clean, and it's effective. There have been more than 500,000 of these injections over the years, and no adverse reactions have ever been reported, not ever, when following the FDA guidelines and doing things the way they're supposed to be done. So the tissues are processed at an AATB accredited facility. That stands for American Association of Tissue Banks. And the tissue is processed and packaged in sterile containers and cryopreserved to protect cell viability so that those cells will still be alive when we thaw them out. The processing procedures do follow the FDA guidelines, and like I said, if they didn't, they would not be still in business. All right, so when we are getting the umbilical cord tissue, the mother's health is rigorously screened prior to donation, and that's important. The only tissue that is used are from C-section live birth deliveries that were scheduled ahead of time. So they already know who the mom is ahead of time, and they have already screened her. And only those who pass the screening are allowed to donate. And so these are harvested from willing and uncompensated donors. Like I said, from live birth, C-section deliveries. The tissues are then carefully processed by licensed professionals, and a sample from every donor is kept on file. Then the tissues are shipped and received, cryogenically preserved to ensure the integrity of the cells. So what conditions that regenerative medicine may be able to help. Osteoarthritis is a big one that we deal with. Also degenerative disc disease, facet joint dysfunction, SI joint problems, and rheumatoid arthritis. So let's just look at what areas of the body that we're looking at here. Hip, shoulder, knee pain, elbow, wrist, hand pain, ankle or foot pain, intervertebral disc or spinal facet joints, partial muscular or tendon tears, peripheral neuropathy, plantar fasciitis, meniscus and cartilage tears, and many more. So let's look at regenerative medicine versus surgery. So with surgery, we've got post-operative bracing is fairly common. With regenerative medicine, for most conditions, no bracing is needed. With surgery, we've got extensive and painful rehab. With regenerative medicine, no surgery involved, not painful, and no extensive rehab. With surgery, we've got months to years for full recovery. With regenerative medicine, there's really little to no downtime, minimal activity restriction, whereas with surgery, there's restricted movement up to 12 weeks or even longer. Also with surgery, 2 weeks to 3 months off work, a lot of times with the possibility of never returning. With regenerative medicine, in most cases, return to work the same day. So here's some x-rays of arthritis progression in the knee. On the left side, we can see what a normal joint looks like. That dark wavy line running between those two bones is what that normal joint space should look like. And off to the right, we've got an arthritic knee joint where that joint space is greatly decreased. We also see that the bones aren't as smooth. There's some jagged edges, bone spurs growing on the bone on the left side of the right picture. Those are all signs of degeneration or osteoarthritis. Also here, looking at the same thing in a hip. Off to the left, normal joint space in the hip. On the right, joint space narrowing. Once again, signs of arthritis or degeneration. And then the shoulder, normal shoulder on the left with that joint space, that dark area running between the bones there. And then arthritic shoulder with just a pencil line of a joint space in between there. Also with some big bone spurs growing off of that bone at the top of the arm. And then looking at a neck or a cervical spine. On the left, nice curve with, there's no longer what's called a joint space, there's disc space. There's disc in between the bones and the spine. And also the bones look nice and smooth, rounded edges on the left side, whereas on the right, you see that those disc faces between the bones have decreased, especially down towards the bottom, and also with some big bone spurs, jagged edges coming off there, all signs of the arthritic progression or degenerative progression. Also in the lower back, same thing as in the neck, got disc spaces, nice disc height in the lower back. We do actually see some minimal bone spurring going on the left side, but fairly rounded edges on bones. But then on the right side, we see severely decreased disc bases, especially as we get lower down in that lumbar area, along with some huge bone spurs going on once again, all part of the degenerative process and signs of arthritis. So here are some pictures of x-rays of actual patients in our clinic. And what we do is we have patients fill out a disability survey prior to getting an injection. And so the number on the bottom left where it says pre-procedure is the score that came off of that disability survey that they filled out. So she was 51% disability prior to the procedure. And we can see on the right that 2 months following the procedure, we had her retake that disability survey and scored a 43%. So even with how severe that degeneration is on the right side of this x-ray, bone on bone with just a thin layer of joint space in between the bones, there was improvement still in 2 months' time. Here's somebody with not quite as severe degeneration in their knees, but also scored a 51% disability down to 24% 2 months afterwards. Here's a shoulder, and we can see that once again, pencil thin line of joint space in that shoulder with some bone spurring, and pre-procedure 38%, post-procedure 2 months after down to 12%. Another shoulder, pre-procedure 34%, down to 2.5% disability on their index score just 2 months after the procedure. Lower back, you can see some of that degeneration in this x-ray with decreased disc space along with bone spurs growing there. Started at 34%, was down to 14% 2 months after the procedure. Another lower back, the x-ray on the left is showing that person from behind, and we can see that spine should be straight up and down when we're looking at you from behind. So there's a scoliosis or a curvature there. And with regenerative procedures, we are not going to get rid of scoliosis or curvature like this. But the great thing is we can still get results as far as getting people relief from pain. Start at 54% down to 28%. Another patient who had back surgery had these bones fused together. Even with all of that, all the things that they had been through, started at 42% disability, had cut that in half down to 20% within 2 months. Another one started at 80% disability, just huge disability, had surgery in the past, you can see towards the top of this x-ray, a few bones down, there's an old compression fracture there. Anyway, down to 2 months post-injection, we're down to 30% disability. Another one who started at 40% down to 2% 2 months after the injection. And these are not from our clinic, but these are pre and post x-rays from another clinic who takes post x-rays after an injection. And this was 1 year after the injection, and you can see clearly how much that joint space had improved in just a year's time. Typically, it's going to be 6 to 12 weeks. Some results are immediate. Some will take longer than the 12 weeks. It is a regenerative process, and there are no promises for results. I can't make any guarantees any more than anyone else in any healthcare field can make any guarantees. How many treatments will I need? Each patient, once again, varies. The goal is to fix the area within one treatment, but some patients get increased benefits with the second treatment. And then for severe conditions and severe degeneration, some patients prefer follow-up treatments as maintenance. Are there any side effects or contraindications? So side effects, no, there really aren't. Some patients have discomfort when they have any type of injection, and so some of those patients might have some discomfort. Very rarely, somebody might get lightheaded or nauseated. That is not very common at all. As far as contraindications, we don't treat any patients who are actively receiving chemo for cancer or anyone who has active infections. So once you're done with chemo treatments, then yes, we can treat you. Once you clear up your infection, yes, we can treat you for that. The only other thing is anyone who has had a total joint replacement, we cannot do regenerative medicine of any type on that joint. So if you have your left knee replaced, but not your right, we could still do something with your right knee. In addition to that, there may be other things that we can do for that left knee other than regenerative medicine. There's some techniques that I do personally that can get some results in many cases. So what are our protocols? Umbilical cord tissue stays frozen until ready for use, and then we thaw it out, and it thaws out in about just 10 minutes. The procedure takes just a matter of minutes itself. Really simple procedure, like some of those patients said, not painful. Walk in, walk out, same as you walked in. So pretty straightforward. The bottom line, across the U.S., umbilical cord allograft therapy is successful in more than 80% of patients. And our success rate in our office has been about 90% or higher. And that's 90% that don't have to have a joint replacement. That's huge. Who do you think is going to get upset about that? With regenerative medicine having such high success rates? That's right, it's going to be the doctors who are doing joint replacements. That's why you might hear some of them say, well, that stuff doesn't work, or don't do it. And the reason is they'd be losing out on a lot of income if you do it. It is low risk, it's high benefit, and has live cells. There are no embryonic or fetal tissues used. It all comes from live birth, umbilical cord. And we are able to help you get back in the game fast. We want you getting back to your life, doing the things that you're supposed to be doing. What does a procedure cost? And this is, big thing that everybody's always wanting to know. Outside the US, these procedures are typically run around $35,000, like in Cancun. In the US, typically the procedure is going to be between $4,495 and $14,995. But when you compare that to the cost of surgery, there's deductibles, co-pays, facility fees, etc. In addition to that, beyond the surgery, there's rehab, there's pills. You're also going to be suffering with a lot more pain and time lost recovering. In our office, typical procedure will cost about $3,500 to $7,500. That's going to be less than out of pocket for surgery for most people. Not only that, but you're not going to be out of work for up to 3 months. Our procedure is safe and highly effective. Are the treatments covered by insurance? Not generally covered. However, and the reason for that is because the drug companies and hospitals have got the big lobby thing going on, and so insurance companies are going to do what these drug companies pressure them to do. And since what we do is not considered a drug, there's no money in it for them. Therefore, they're not going to lobby for this. Other services we provide may be covered, such as x-rays, braces, or therapies. Remember, our procedure may be less expensive than the out-of-pocket, just simply the out-of-pocket for surgery alone. Are there any discounts for financing available? Yes, both are available. We are able to discount care based on how you pay for your care, so we can give discounts for paying it in full. Therefore, we don't have to take time to try to collect more payments from you. In addition to that, we've got in-house financing, short-term with no interest, and we've got outside financing company. However, when you do that, you don't get some of these discounts, and there's going to be additional fees and higher interest, so it's going to end up costing you more in the long run that way. But you are able to get your payments down to more reasonable payments if you're not able to pay up front in full. It is a simple program. Like I said, we follow the research. We want to do what is right for you. We want you to have good results, because if you get good results, you're going to let other people know about it. And we really are only going to take people who are really qualified to be able to do what we do, because we do want to get results. So I do want to play another video for you here.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
And one thing I want to point out about this video is when you look at the lady on the left compared to the right, some things you might notice about her. She looks happier, she looks younger. So when you do have a condition that is wearing on you, it does affect the people around you who love you. They did a great job with that video. So steps to your wellness. First, you need to decide that you do want to learn whether you qualify, then make an appointment for a visit. My preference is that you call the office because we are going to talk to you. One of our clinic staff members is going to personally talk with you to get information that will help us pre-qualify you. It's going to help us determine if you would be a good fit for regenerative medicine. I don't want to waste your time having you come into the office if you really are not a good fit. So we want to pre-qualify you. And so either way, one of our staff members is going to need to talk to you on the phone prior to your visit. Then you come in for an evaluation. If you have x-rays, get those to us beforehand so that we can review those. That's really important. So we have forms in our office that we can send out to you that you sign, send it to wherever you had the x-rays taken. If we don't have a form for the office where you had your x-rays taken, you can go in, sign a form, and they can get those x-rays for you or have them sent to us. Then we'll talk about the program, how we can make it successful for you, and we'll cover finances at that time before you make any decision. And then you set up a time to return for your procedure. Really simple. So do you qualify? Once again, the qualification process starts on the phone, talking with the staff member to see if you pre-qualify so that we're not wasting your time if things aren't looking like it's going to be a good fit for you. Then if you do pass that test and you get to come in for an evaluation, we'll go through your history. Once again, important that we get your x-rays. Then we'll go over exactly what you've been through, so what has worked and what has not for you. And you know, with medications, some of those pain relievers, think about if you put your hand on a hot stove, the pain is going to be there immediately and it's going to tell you that something's not right, so you pull your hand away from the hot stove. It's your body telling you you need to fix the problem. If you're covering symptoms up with medicine, it's covering up the pain, it'd be like keeping your hand on the stove, and it's going to lead to worse damage down the road. In addition to that, it's really important in the healing process to be eating properly and have some type of an active lifestyle, because that's a big hole in our schedule. You see, we don't see more than 5 or 6 consults per day. It's not the regular type of clinic that's seeing 28 patients or seeing 1 every 15 minutes. We devote an hour or more to all of our consults, so we only schedule 5 to 6 per day. So if we schedule an appointment for you, we need for you to show up. Then call our clinic, and our clinic number is right there on the screen. Only when we know the extent of your problems and the causes will we be able to determine if we can help you and what would be involved. We would then work together to provide a program for you. So why schedule now? Well, when's the best time to plant a tree? 20 years ago. When's the next best time? Today. So there's no better time than now, since yesterday is gone. When we wait, we forget. And degenerative conditions are going to continue to get worse with time. You got nothing to lose because we're not going to waste your time or money. If we cannot help you, we will tell you that. All we ask is for you to give us a chance to help you enjoy your life to its fullest. Our purpose is to help you live a happier, healthier, longer, pain-free life. Remember, problems, they get worse over time. Showed you all those x-rays of degeneration. That happens over time, and it continues to get worse over time unless something is done to stop it. So unless you try something new, your problems are not going to go away on their own. Once again, my name is Dr. Lance Carroll, and give us a call, see if you qualify, and we'll go from there. Thank you very much and have a great day.